Hello, everyone, and thank you for joining this PHA Live webinar on preparing for the 2026 open enrollment season. My name is Jager Spratt, and I am PHA's Advocacy and Treatment Access Program Manager. So things that we'll be covering in this webinar, I'll give you the open enrollment deadline reminders. I'll cover different sources of health insurance, how to choose a health insurance plan, tips for troubleshooting insurance problems and where you can find help. And finally, I will go over some upcoming insurance changes that will be happening both next year and a little on later in 2027 as well, just to help everyone prepare and know what's coming down the line. So firstly, this year's dates are going to remain pretty similar to last year. So that the marketplace insurance, that's for the ACA or sometimes known as Obamacare, the marketplace insurance open enrollment window will remain the same starting November 1st and going through December 15th for insurance plans that would begin coverage starting January 1. There is still a bit of an extension until January 15, and there are a couple of states that have a longer extension beyond January 15. So if you do make insurance changes during that window after December 15th, 2025, then your insurance coverage wouldn't start until February 1, 2026, or later if you make that change after January 15, if you happen to be in those states that have that further extension. And then for Medicare, that's the same as it's always been. That open enrollment will begin on October 15th and will close on December 7th. And there is, of course, also that sort of grace period where you can switch specifically between Medicare Advantage plans or from a Medicare Advantage plan back to original Medicare. That's during the first 3 months of 2026 up until March 31st. If you already have Medicare or original Medicare, you wouldn't be able to make any switches. But with Medicare Advantage, there's a little bit of grace period. And then for commercial plans, those are sort of, it depends on the source of your insurance. That's most commonly through an employer, whether that's yours or your spouse's employer. So the best bet is to just reach out to your HR department or whomever kind of manages your insurance and check what those open enrollment dates are. But typically those do fall during some time in the fall portion of the year. So this is still a really good time to be thinking about open enrollment and what things you want to be aware of when you're reviewing your plans and potentially making changes. So for this presentation, I am going to start off at just kind of a very ground level. I'll cover this relatively quickly, but you will have access to the slides. So if there's any topic I cover that you're not as familiar with, you're welcome to either put a question in the chat or you can, refer back to the slides later, or, you're welcome to also email me at insurance@phassociation.org, and I can provide some more context for those questions as well. But so for the very most basic question, what is health insurance? Insurance is basically like a wager between you and the health insurance company, and that company is kind of making a bet that they will bring in more money in premiums overall from all of their clients than they will have to pay out in benefits for their clients' healthcare services. So you pay a premium every month, kind of just in case something happens, almost like a monthly subscription fee to keep receiving your insurance coverage. And then before we go into different insurance options, just a couple of quick words, some definitions to make sure you're familiar with. The most basic coverage, that's how much your insurance will pay for of a bill for a medical service or a prescription. Your health insurance policy is a contract that is just kind of spelling out what that coverage is, what your plan does and does not cover. Each policy also has different types of out-of-pocket expenses. So we just talked about the premium that you pay each month. There is a co-payment or co-insurance. Those two are similar. That's an amount that you would have to pay for a specific service. If it's a co-payment, that means it's a set amount that doesn't change. If it's a co-insurance, then that is a percentage of the cost. So if you get a less costly service, then you pay less. If you have a very costly service or a particularly costly prescription, that co-insurance amount will be larger. And then additionally, some policies don't provide any coverage until you have paid an agreed upon amount out of your pocket. That's called a deductible. Some plans also have an out-of-pocket maximum, or sometimes called a catastrophic limit. So that means once you have paid a certain out-of-pocket amount, the plan will cover most of your remaining medical expenses for the rest of the benefit period, typically the rest of the year. So let's dive into the different types, or I would say maybe sources of health insurance. The main two types are public health insurance and private health insurance. So public plans, also called public payers, are government-funded programs that help you pay for your medical treatments. Some of the most common or most well-known are Medicare and Medicaid. And then private plans, sometimes also referred to as commercial plans, as I mentioned earlier, those are funded most commonly by an employer. So it is usually managed by a private insurance company. It is sometimes also managed by your employer themselves, in which case it would be termed self-funded plan. These ones are less common. This is where the employer, or sometimes it'll be a labor union, pays for the members or the employees' healthcare expenses directly, rather than contracting with a private health insurance company. So in this case, the employer or the union is the insurer, and they are carrying any associated risks for their employees or members. So let's start with Medicare. I know this is a pretty complex one. There's a lot to this plan, and a lot of folks are already somewhat familiar, so I won't linger too long on this. But just to sum up, Medicare is a federal program. It provides health insurance coverage for folks who are 65 years or older, regardless of income level at that time, or for people who are under 65 years old, if they have been granted Social Security disability after 2 years, then they qualify for Medicare insurance. Medicare has 4 main parts referred to as A, B, C, and D. Part A is primarily hospital or inpatient care. Some related care facilities also get grouped in with this. So this part is free for everyone who has worked and paid Social Security taxes for at least 40 calendar quarters, which comes out to 10 years, but doesn't have to be a consecutive 10 years. So if you haven't worked that long, or if you did work, but you weren't paying Social Security taxes for those 10 non-consecutive years, then in that case, you would have to pay a monthly premium. And then Part B is for outpatient care, as well as durable medical equipment. So under that would be included things like oxygen equipment, or pumps or nebulizers related to a prescription drug, but requiring some sort of equipment to administer it. Though that one is always, I believe, requiring you to pay a monthly premium, regardless of paying into Social Security taxes or not. And then Part C, which is commonly called Medicare Advantage, basically takes Part A and Part B and combines them together. So that's one single plan that provides Part A and B. And then a lot of Medicare Advantage plans do also lump in Part D. So Part D is prescription drug coverage. If you have original Medicare, if you're getting that Part A and Part B separately, then you would also need to select a Part D plan. So it is voluntary to enroll in Part D, But if you are eligible for Part D and you don't have some form of coverage, whether through Medicare or another employer or another plan, then you could be subject to a late enrollment penalty. So that is something to look out for. And then lastly, some folks with Medicare will also purchase a Medicare supplement, or sometimes referred to as Medigap, or sometimes even called Part G or Part F. All of those are kind of talking about the same thing, which is a supplemental insurance policy that would help to cover healthcare expenses that Medicare Part A and B don't cover. So these Medigap supplemental policies can only be combined with original Medicare Part A and B. So folks with Medicare Advantage are not eligible to get a Medigap plan. And then enrolling in Medicare Advantage and in a Part D plan, typically that is what you're looking at when you are arriving at an open enrollment period for Medicare. And then I kind of already referenced this, but just as a reminder, so for Medicare with Social Security disability assistance, once you get approved for that, after 2 years, then you have access to Medicare. However, during that 2-year period, there is sort of a potential gap for coverage. So 2 options are receiving Medicare, until you can receive Medicare, are to receive insurance from your previous employer after you've stopped working through COBRA, or you can turn to an individually purchased plan from the ACA marketplace. And I'll go a little bit more into that in detail in just a moment. Then some other public insurance sources include Medicaid. So Medicaid is partially federally funded, but it is run by each of the 50 states individually. So that specific type of health insurance coverage is intended for low-income individuals, especially folks who are disabled, folks who are elderly or minors or are pregnant. Medicaid programs, since they are run separately by each state, have different names. And they also sort of vary in the amount that they'll cover and other kind of eligibility details. Those vary a lot by state. One thing to take note of, not every state calls their program Medicaid. So for example, in Tennessee, that would be called TennCare, T-E-N-N care. And in California, Medi-Cal is the name for their Medicaid program. So it's important if you have some kind of insurance to make sure you know whether that is Medicaid or not, because whether it's called Medicaid or called something different, it is still affected by any policies that are applicable to Medicaid. Another program is the Child Health Insurance Program, or CHIP. This sort of works in tandem with Medicaid. It's a state program that provides low-cost health insurance coverage for children and families who have just a little too much income to qualify for regular Medicaid coverage, but whose family can't really afford to purchase an adequate private health insurance option. So CHIP can step in and make sure that those kids still get covered. And then lastly, for anyone who serves in the active military service or is a veteran, there are specific insurance options for people in those groups. So for more information about that, you can reach out to the U.S. Department of Veteran Affairs. So then let's get into private and employer-based insurance. So like I mentioned, that group coverage through an employer is kind of the most common source for health insurance. But then also individuals do have the option to purchase health insurance through a private company themselves. And like I mentioned earlier with COBRA, that stands for the Consolidated Omnibus Budget Reconciliation Act. So that is potentially a bridge between an employer-based health insurance option and insurance from some other source. It is important to keep in mind that this coverage can get very expensive over time because you don't have an employer that is supplementing the premium. So a lot of employers, as a benefit to their employees, will cover some or all of the cost of the monthly premium. And then in addition to that, when you're receiving your coverage through Cobra, um, per those regulations, the insurance company that is providing it is allowed to charge you upwards of 110% of the premium. So it's even a little bit more than the full amount of the premium that the employer was paying. Um, so if you do stop work, you can maintain your group coverage for up to 18 months, but you do have to notify your employer within 60 days of that qualifying event of stopping work. Um, and then if you are leaving work specifically because of a disability, then the COBRA regulations provide an additional 11 months, which kind of brings that total to the 2 years, which would be about when your Medicare eligibility would kick in. Um, so this is one reason that it's really important to apply for Social Security disability immediately after you stop working, or especially if you do believe that you might be disabled for a year or more. And then also important to note that the 11-month extension that I mentioned with Cobra is not automatic. So you do still have to apply for that, even if you are eligible. So individual coverage, like I was talking about, can be purchased directly from a health insurance company. Um, it is important to be aware of something called junk plans, which I'll go into detail in a little bit later. So that's sort of a colorful term for what we call a short-term or a limited duration health insurance coverage. So those plans kind of offer very low premiums, but you kind of you get what you pay for. So they have very high deductibles or very high cost sharing requirements, and they aren't following the types of insurance regulation that other more comprehensive coverage plans are offering. So I'll go into a little bit more detail of how to avoid those plans later on in this presentation. And then lastly, there are some sort of blended public-private insurance partnerships, some forms of public health insurance with elements that feel more like private health insurance. So Medicare Advantage is an example of this, because these are public plans and they are only available to Medicare eligible individuals, but they're receiving coverage from a contracted health insurance provider. So Medicare is contracting with that provider to give coverage and benefits that, are following the Medicare regulations, but with some exceptions. So they, for instance, will follow the private insurance company's network rather than the Medicare network. So it's important, if you're looking at a Medicare Advantage plan, to make sure that all of your providers, especially any specialists that you need to see to maintain your quality of healthcare, are in network if you're signing up for an Advantage plan. And then another example of health insurance coverage are those insurance marketplace exchanges that were created by the Affordable Care Act, which I had mentioned earlier. So marketplace coverage does operate a little bit more like private health insurance, but it is federally subsidized and regulated, which is important. So there's no eligibility requirements beyond your ability to pay the monthly premium for the most part. But you also get access to sort of the consumer protections that were put in place by the ACA. So that law requires insurance purchased through a health insurance exchange to include a minimum level of coverage for key services, which are called essential health benefits. So these plans are not allowed to discriminate against individuals with pre-existing conditions. They can't include annual benefit caps. And then also there is financial assistance potentially available for folks who are lower income, as well as for families, to help them purchase insurance through a either state or federal insurance exchange. So you would go to healthcare.gov to get to those marketplace plans. Okay, so that is sort of a summary of all of the different sources of insurance that some are eligible for, some obviously are a little bit more specific. But if you have options for a range of different healthcare plans from a particular source, it's important to make sure that you're choosing the right one. So healthcare plans of all kinds have what we're calling open enrollment period, which we covered what those deadlines are. So this is a time when you are allowed to either add or change your coverage, and there's no penalty. You can do that freely. So this is a really important opportunity to check over what your health insurance options are and to see if there's been any kind of change to your coverage from the plan that you currently have, as well as just to kind of consider any potential changes that you might need for your healthcare in the coming year. So it can be kind of a lengthy process, but to do this really thoroughly, a good method is to start by gathering information about your plan options and listing out each plan option available to you. Once you have kind of a list of your options, then you make a separate list of your healthcare needs. So start by listing out the medications that you take, any medical care you're expecting to need in the upcoming year. So that might be routine tests, or if you sort of can see a pattern in your health journey where you can expect that you might need to be hospitalized at some point during the year. All of those things are important to kind of keep in mind. And then once you have those two lists of your plan options and your medical needs, then go through each plan option and check kind of what what coverage is available for those needs. So you'll want to take note, of course, of each plan's monthly premium, that monthly cost for each option, and find out if the plan requires you to pay a deductible before that coverage begins, and make note of what that deductible is. And then as you're looking through your list of anticipated medical needs, compare that against the plan options and see which of those needs are covered and by how much. So for example, are your pulmonary hypertension medications included on that plan's prescription formulary or the covered drug list? Does that plan have a limit on the number of nights in the hospital that it will cover? And then also take note of how much of that cost each of those items the plan will cover. So, for example, for your pH medication, are you charged that set dollar amount, that copay, or does it ask you to pay a percent of the drug price, the coinsurance? So once you have all of those pieces of information, that gives you the ability to compare the total cost of those plan options. So that includes the premium and how much that you would have to pay out for your medication copays and other expected medical service needs. And then you can kind of that way more directly do an apples to apples comparison of how much you would have to pay out, how much the plan is going to cover. So as a general rule, plans with a higher premium tend to cover more services, or they'll cover them at a higher rate. So depending on how large or how costly of medical needs you're expecting to have in the coming year, sometimes those plans with the higher premiums will actually end up being a better deal overall once you've factored in your total costs. And then lastly, it's also really important to double check the information about that plan's pharmacy network. So folks who have PH need to make sure that they are able to receive medications through specific specialty pharmacies. So if the specialty pharmacy that you've been working with is not in network, that could cause a problem. And then lastly, something to note as far as plan categories go, those plans, especially if they're purchased through your state's insurance marketplace, have 4 categories of a plan. So it goes bronze, silver, gold, and platinum. These categories are telling you how much you and the plan are sharing costs. So a lower premium is connected to a higher rate of cost sharing for you. Um, so if you have a bronze plan, that is kind of a shorthand to tell you that you will pay out more. If you have a platinum plan, that's shorthand for you are paying out less. That the plan is covering more, basically. So those platinum plans would have a higher premium, but you don't pay as much for the services. So those categories don't have anything to do with the quality of care you're receiving. Those plans are all equal as far as quality, it's just how much you pay. And then commercial plans through employers do often have kind of similar packages that'll vary with how much cost sharing you're responsible for. So one of the top questions that I get when people are trying to compare plans is whether their specific drug will be covered. This one is definitely hard to answer, so it makes sense that I get that question. And it unfortunately can be kind of difficult to find solid information about this. You really may have to search for a while and try a couple of different avenues for finding out that information before you can get to the answer that you need. The best starting place is with the website for the plan that you're looking at. So whether that's the plan you currently have or one that you're considering, you want to go to that website. So over on the right-hand side, I have a screenshot of the formulary list for a random insurance company, WellCare, that I have pulled up. So a lot of websites will have a search bar somewhere in their top menu or banner area. So if you find that search bar, you can type in formulary, and that should bring up a couple of different pages, one of which should be the correct one for you. Another option is also to try Googling the name of your plan, the upcoming year, so 2026, and either the word formulary or drug list. One thing to note, so a lot of plans don't publish their formulary very early on. I think usually by October, most plans do have that formulary information available, but I have heard of some plans saying that they just can't release that until like January 1, which is obviously extremely frustrating because how are you supposed to choose that before the plan starts? Um, so it can be complicated. Um, I think bottom line, kind of, if you are struggling to find information about this, the best bet is to just call the plan directly and ask them as many specific questions as possible. It really does pay off to stay patient and keep being persistent, keep digging for those answers until you get something. One thing that can make it a little bit easier if you do find your particular formulary list, usually that's going to be on a PDF, sometimes it's in a web page, but in any case, on any web page or PDF file, you can press the control key plus the F key, the F letter key at the same time, and that brings up a search bar for that page or document. So this kind of makes it easier to search for the name of your drug, or you can even start by searching for the word pulmonary, since some formularies are organized by the type of condition that each drug is treating. So that'll sometimes bring up a list of all of the pulmonary hypertension drugs available on that plan, although other formularies might organize by something more broad, like cardiovascular, so it's not always going to give you the list that you need, but searching by drug name for sure should kind of tell you exactly, is that drug on this list or not. And then also something to consider, avoiding junk plans like I was talking about. So the Affordable Care Act, that law has provided a lot of patient protections and makes sure that plans that are ACA compliant are providing comprehensive coverage. So there's a couple of different sources to find ACA compliant plans. The first and kind of most easy one to find is through healthcare.gov, which is the marketplace exchange, or some states do have their own version of that. They're equivalent, they're just as good. It's just specific to your state. There is also the ability to find kind of off-exchange options of plans that are still ACA compliant. One thing to note though, if you're not getting a plan through the specific marketplace exchange or your state's exchange website, then you would forfeit your right to get financial assistance if you qualify for it. So just something to keep in mind. If you might be qualifying for financial assistance, you are better off going through healthcare.gov to find something through the exchange. So some ways to make sure if you're looking at a particular insurance plan and you're not sure if it's ACA compliant, you can ask these questions, and if the answer is no to any of these questions, it is not ACA compliant. So you want to make sure you're asking whether your insurance plan doesn't require access to your health history and doesn't use medical underwriting. If it uses medical underwriting, if it requires you to submit health history information before it'll tell you whether you can be covered, that is not ACA compliant. If the plan covers pre-existing conditions, if it is guaranteed to be renewable as long as you keep paying the premiums, if it covers maternity care, prescription and specialty drugs, and mental health care, and if it has a flat cap of how much out-of-pocket costs you will have to pay for medically necessary and in-network care, all of those things are your right according to the Affordable Care Act. So if your insurance plan is comprehensive, it will cover all those things. The reason I'm making an extra special point of this is because there's been recent legislative and regulatory changes that are going to affect ACA plans and just in general kind of make it harder to access and more costly to obtain those plans. There's also regulatory changes that are going to lead to less oversight of plans that are not ACA compliant and weaker consumer protections around types of short-term limited duration insurance, as well as catastrophic coverage insurance. So those are plans that, while they might be suitable for folks who are healthy and are not going to need intense coverage or a lot of health services, for people who have chronic illnesses or have like very specific healthcare needs, those plans are not going to be adequate. And then the people who get those plans are sort of stuck with them until the next open enrollment period. So it's important to sort of keep a lookout, make sure you're asking the right questions and avoiding anything that sort of seems too good to be true, basically. These plans might have very low premiums, but then you want to look at that trade-off and make sure that you understand really what you are and what you are not getting with the plan that you're choosing. So I know that was a whole lot of information. It can feel kind of overwhelming if you have several different plan options to choose from. There are some organizations that have assistance available, including one-on-one case management, that can help you decide what health insurance is going to be the best for your particular needs. So the Patient Advocate Foundation has a case management service that is free to anyone with a chronic or serious illness. You can call that number or visit their website. The Medicare Rights Center has some really good information about Medicare. And then lastly, the State Health Insurance Assistance Program. There is one of those programs in every state, and that can also offer some guidance. Additionally, if you are looking at the Marketplace Health Exchange for plans with that, you are there's available some brokers or like insurance kind of navigators that are certified and will make sure that you're getting the right one. So it is also important to ask for their qualifications and double check that they are certified, because there's folks out there who are not that might try to steer you towards a junk plan. But if you find a broker that is certified for marketplace plans, they can be really beneficial in going over what your medical needs are and making sure that you choose a plan that will fit with them. Okay. Next, I will touch on some common insurance challenges and ways to navigate them. Again, I'm going to go through some of this a little bit quickly, but if any of it looks especially interesting or you want more information, you can either put a question in the chat or reach out to me at insurance@phassociation.org. So there's a couple of ways that insurance providers attempt to sort of limit how much they have to pay out. So one way is by excluding, which would mean that the plan only covers specific services, products, or providers under the plan. So this would include things like a formulary, that limited list of drugs that are covered. Another method is limiting. So that could be something like a quantity limit where your plan sets a maximum number of products or services that they will cover. So for example, with pulmonary rehab and Medicare, Medicare typically will cover up to 36 sessions of pulmonary rehabilitation and no more than that. There's also cost sharing limits. So cost limits are restrictions on the cost of services or plan that can, well, previously that used to be through an annual or a lifetime cap. However, under the Affordable Care Act, lifetime caps are no longer allowed. Then in addition to cost sharing methods to determine benefits, I guess, well, not in addition, but this is also sort of where that copay or coinsurance would fall as far as like a type of benefit limit. Those cost sharings would be, anything that is making you take on part of the service. You do also need to be aware of those preferred in-network versus non-preferred or out-of-network providers. That can certainly be a place where your plan might limit or, shift more cost-sharing responsibility onto you. So a couple more benefit terms. Prior authorization is when the medical provider has to provide proof of medical need before a service is allowed. Very occasionally, there might be a plan where you are required to send in the prior authorization, but very commonly that is something that your healthcare team would take care of. But it's very common for folks with pulmonary hypertension. A lot of PH therapies do require prior authorization, which, for better or for worse, does mean that a lot of our specialized PH healthcare providers have become very well experienced in providing that or in completing those prior authorization requirements. Another way of limiting care is also step therapy, or sometimes referred to as fail first. So that is when the insurance company requires you try one medication, which is commonly a less expensive medication, and requires you to show a documented lack of improvement before your health insurance will cover that medication that was originally prescribed by your physician. For step therapy, there is typically an exception process that you can follow to convince your plan that they should cover a particular therapy or product or provider. This is sort of in general, you can always appeal. So if your insurance has denied for whatever reason, remember that you always have the right to appeal. And your healthcare provider or healthcare team is often a really, really important resource in getting that exception approved. So a lot of prescription drug plans have a tier of drugs. So the health plan beneficiary would have to pay more for a medication that is at a higher tier. I think a lot of folks are pretty familiar with the fact that PH therapies tend to be on the highest cost tier. And unfortunately, that is the case with some insurance plans. Even for generic PH therapies will be placed at that high cost tier. So that's something to keep in mind, especially if you currently receive a copay card or some other form of financial assistance directly from the manufacturer of your pH therapy. If you end up needing to or being forced to transition to a generic therapy when you had previously been on a brand name therapy, um, it doesn't always result in you paying less if you had that copay card or other kind of assistance from the manufacturer. So it's important to make sure that you're working with your PH team or especially or also with your specialty pharmacy to make sure you understand what you will end up having to pay out of pocket for any therapy that you're put on. And then also, as with the benefit exclusions, there is usually an exception process that you can follow to convince your plan to cover a drug or a service. So if something's not included on a formulary, you would seek a formulary exception. So that's a kind of a good workaround if you find a plan that would otherwise work great for you and maybe covers, some of your pH medications, but one of them's not covered. It is possible that you could apply for and get a formulary exception that would allow that medication to still be covered. And then another challenge can be sort of life transitions or employment transitions. Um, I'll kind of go over these a little bit quickly, but generally, if you know that you are approaching some type of a transition, it's important to try to get support, talk to your healthcare team, and explore your options early. So the Patient Advocate Foundation that I had mentioned earlier, PAN Foundation, Medicare Rights Center from that previous section, all of those can be really helpful if you have the sort of foresight to be aware that you are approaching a transition. Um, so you might also encounter a transition if you are looking at entering a trial work period when you have Social Security disability. If you want to test your ability to return to work, you can apply for the trial work period. That might eventually lead to a transition in your source of insurance. Your employer might also just decide to change your insurance carrier. So if that happens, sometimes you don't get as much notice about that, unfortunately. But as soon as you do find out that that will be happening, make sure that you do let your healthcare team know. And it's also important to contact your pharmacy and let them know as well. Um, and then also one type of transition would be age. So when you're turning 18 or 26 or 65, that can be a point at which you would have to transition. So at 18 years old, children who are receiving a supplemental security income have to reapply as adults. And then the Affordable Care Act has given the right for children up to age 26 to stay on their parents' health insurance plan. So once you do turn 26, at that point, that young adult has to go and get their own health insurance. Um, and then again, with turning 65, that's when people become eligible for Medicare if they weren't already eligible due to disability. So all of those things are an important time to sort of try to be looking ahead and seeking help to make sure that you can navigate that transition smoothly. And then lastly, marriage or divorce or retirement or the loss of a spouse. If your spouse is your source of insurance, that can trigger obviously a change in your insurance coverage. So briefly, I will also cover some laws that are important to keep in mind. This basically just is some health-related laws that give you certain rights. Some of these I've already gone over, but COBRA, as I mentioned, makes sure that you can keep your health insurance policy if there's a change of your employer. The ERISA is the Employment Retirement Income Security Act. So that basically governs private health insurance for those self-insured institutions, just to make sure that they are still providing adequate insurance. FMLA, that is Family and Medical Leave, provides the right to take time off to address family medical issues. HIPAA, Health Insurance Portability and Accountability Act, has a set of laws that gives protection for your personal information, as well as sort of outlining standards for portability and pre-existing conditions to make sure that you are protected. And then lastly, GINA stands for Genetic Information Non-Discrimination Act, basically prohibiting insurance providers and employers from discriminating based on genetic information. And then just kind of in general, knowing your rights and resources can really put you one step closer to being able to access treatment if you do come across any kind of resistance. Um, so just knowing what those healthcare laws are on the previous slide, as I mentioned before, appealing, you always have the right to appeal. If you do find after appealing that the problem that you've had with your healthcare plan is still not getting resolved, you can move forward to the next step of filing a grievance or a complaint. So that might be through your state's Department of Insurance. That's a state-based regulatory agency that oversees and enforces state insurance laws, and also gives insurance consumers, people who need the plan, protection, and it regulates the insurance industry's practices. And then you can also look for a patient advocate. So that might be through your healthcare plan, through your hospital, a specialty pharmacy, or an independent organization. There's a lot of different sources for you to ask for help. And then lastly, another place to turn to help, what you might not think of, is your elected official. You can tell your story of whatever problem you're experiencing to your local, state, or federal elected official, and they typically will all have a constituent services staff member whose job it is to figure out how they can help their constituents. So just overall, remember, you are entitled to understand the insurance coverage that you have and to know what things it does and does not cover. You have the right to be heard. So we know pH drugs can certainly get expensive, so I'll also cover some financial assistance sources. This certainly can be especially challenging if you have, multiple conditions or medications and needing treatment for multiple conditions. It can certainly sometimes be challenging to find the right resource, but again, that patience and determination is really key. So firstly, PHA has a specific website that provides up-to-date information on potential nonprofit assistance funds, drug manufacturer assistance programs, help through your specialty pharmacy, or finding federal, state, and local help. So all of those, there's a lot more information at phassociation.org/help. And now I want to dive into some insurance changes that are going to be coming up for 2026 and beyond. So we'll start with the Medicare changes. Some of these have actually already happened, but I just wanted to remind people of changes that took place in 2025 and give an update on what will happen with them in 2026. So this year, 2025, the Inflation Reduction Act, which had passed a couple years ago, the kind of largest set of changes rolled out this year for Medicare beneficiaries. So as of 2026, the Medicare Part D out-of-pocket cap will be raised just slightly from $2,000 to $2,100 or $2,100. So that'll be the new cap for 2026. And this $2,100 cap will continue to automatically be applied to everyone who has a Medicare Part D plan, as well as folks who have Medicare Advantage programs that include a prescription drug plan. So this out-of-pocket cap, unfortunately, does not include the cost of drugs that are covered under Medicare Part B, B as in boy. So it only applies to medications that are covered by a patient's Medicare prescription drug plan, So just keep in mind, some Part D plans might choose not to cover certain pH drugs. So again, like what we talked about with checking your formulary, make sure that it is included. But if it is, then you would not have to pay more than $2,000, or sorry, $2,100 in 2026. And then also, as of this year, a new payment option was rolled out called the Medicare Prescription Payment Plan. That is also still available for next year. This program allows you to spread out your out-of-pocket costs across the calendar year. So it's something called smoothing, basically, and that will be up to the $2,100 out-of-pocket limit. So it is optional. You do have to opt in, but if you enroll in this program, then you end up no longer paying directly to your pharmacy for your covered Part D drugs. Instead, you would receive a monthly bill from your Part D plan sponsor, whatever company is managing that, and you would just pay that directly to your plan for any cost sharing that you owe. And then your plan is the one who pays the pharmacy for your medication. So there's no cost to participate. There is no interest or fees on the amount owed. Even if you make a late payment, there's not a late fee added on. It's just the amount that you pay. So it's never going to be more than $2,100 for those covered Part D drugs. And to enroll in this program, you would have to call your plan, or you can also look for on your plan sponsor's website, you can look to enroll in or elect to opt into the Medicare prescription payment plan on the website. And so during open enrollment, which, like we said, for Medicare is from October 15 to November 7, beneficiaries have to opt into that prescription payment plan for the 2026 year. Even if you were in, well, let me back up. You don't have to opt in if you were enrolled in 2025 and you haven't made any changes to your plans. However, if you were enrolled this year in 2025 and you make a change to your plan, if you opt in for a different plan, then you would have to go with that new plan and let them know that you want to enroll in the prescription payment plan. There is always the option to enroll or to opt into the prescription payment plan throughout the year. So if you don't get it done by January 1, that's fine. You do still have the option at any point in the year. It just begins to be a little bit less cost effective if you enroll much later on in the year. And there's a lot more information about that because I know it can sound a little bit complicated, but we do have information about that on the website. And again, you're welcome to email me if you have questions about it. Okay, so moving on, changes to the Affordable Care Act marketplace. So there was a bill, the One Big Beautiful Bill, as well as a couple of other regulatory rules that have kind of created some unfortunate barriers to the ability to enroll in marketplace coverage and have sort of put some additional eligibility verification in place. So just in general, it's a little bit more challenging. The biggest change that's coming up soon is for in 2026, the average full price premium is on track to increase pretty significantly. So there have been premium subsidies, and that the current law that had put those subsidies in place is set to expire at the end of this year. And so far it has not, that subsidy enhancement has not been extended. So for people who will still qualify for subsidies, you will have some financial assistance, but it won't be as much as we were getting previously. And those have been in place since 2021 for reference. So there is still a chance that Congress could choose to extend the subsidy enhancement, but so far it has not done so. And so because of that, that's part of why premiums are increasing pretty strongly in 2026. Insurers are sort of expecting that a lot of folks might choose to drop their coverage because there is a smaller subsidy available. And especially for folks who don't have as strong of a need for health insurance, they may just choose to drop it. So this unfortunately is going to lead to a potentially smaller kind of risk pool of people who are getting insurance from the marketplace exchange, and there is a tendency for the folks who are getting their insurance there to have more severe health conditions. So overall, that is leading to insurance companies increasing their premium costs. Another change is, so currently there is a low income special enrollment period, which basically allows folks who have income at or below 150% of the federal poverty level to enroll kind of at any time. So that has been done away with. Regardless of your income level, your enrollment period is the same open enrollment period. So just a little bit less flexibility there. And then also starting in, so not at the beginning of 2026, but fall of 2026, so next year's open enrollment period, states that use the healthcare.gov will have a smaller regular open enrollment period that will end on December 15th. So some states that have their own insurance exchange do have the option to extend that open enrollment window until as late as December 31st, but this new ruling requires that all plans take effect on January 1, 2026. So there's no option for a later, like February 1 effective date for a new plan to start. So this makes it really, really important next year for folks to pay close attention to their renewal notices during open enrollment, because there's just a little bit less flexibility. There's no longer an option to switch to a different plan after January 1 of 2027. Aside from if you do qualify for a special enrollment period. So then lastly, for now, some Medicaid changes coming up in 2026 and 2027. There's not too much that's going to happen next year in Medicaid. I know with the one big beautiful bill, that does have a lot of Medicaid changes, but most of them that would affect patients, people with insurance, are not taking effect until the following year. So the ones taking effect in 2026 are largely kind of behind the scenes for the public, and they're funding related changes for those states. So we could see some changes that would be connected to certain care facilities, maybe getting less funding from Medicaid due to those funding changes, but that would be kind of the biggest change that we would see. And then, so starting in 2027, the new law calls for increased work requirements and also requires states to reevaluate enrollees' Medicaid eligibility every 6 months as opposed to every year, how it currently is. So these changes are largely for folks who are covered by Medicaid expansion. So that would be people whose income is less than or at or less than 138% of the federal poverty level, which for this year, for someone who is filing as a single person, would be $21,597. And so that also would include people who are not elderly, not pregnant, not disabled, not a caretaker of children, or someone with a disability. So all of those people in that group do not fall under Medicaid, Medicaid expansion, and would more likely be able to get an exception to the work requirement. Other folks who can also request work exceptions would be folks with chronic illness or guardians of children under age 13. However, one thing to keep in mind, the Department of Health and Human Services has not yet released an official definition of chronic illness as it relates to this new law. So Just kind of in general, these changes are still in flux and we are still learning things about them. So PHA is taking it very seriously to make sure we are educated about these things and passing along that information as soon as we learn it. So for right now, if you have Medicaid, the most important steps to take are to confirm that your state Medicaid agency has your correct contact information. You want to make sure that that gets updated, and be on the lookout and make sure you're responding promptly to any kind of administrative communications about your eligibility or coverage renewal. And then sort of lastly, just things to keep in mind. There are a lot of legal disputes about all of these changes. So a lot of these changes are still in flux. There's quite a few states that have filed lawsuits that would dispute the changes. And then sort of in those lawsuits, there are some courts that have ruled to stay the change, meaning there's sort of a delay or that change is not going to happen yet until more legal decision making can occur. So of course, if those cases and rulings where something is stayed is appealed, and then on the appeal, a different decision gets made, it's just basically bottom line, things are in flux. And then, like I mentioned, the implementation on definitions such as what is chronic illness and just a lot of other ways that these really large laws have been released, the way that they're implemented will affect a lot how good or bad or neutral a change might be for people, especially people with chronic illnesses. And then also states may end up getting some agency on how to follow that guidance. If the guidance is looser, then that might give them more wiggle room to sort of follow the law, but do so in a way that is a little bit more helpful for people who need assistance or who, to just make sure that people can still stay covered, basically. So a lot of this is just things are in flux. We will let you know as soon as we learn more information. So again, I know I've talked about making sure you're reaching out for help. So just a couple of resources to keep in mind. PHA, of course, as a resource, we have an insurance guide online that you can find at phassociation.org/patients/insurance. As I mentioned, you can also reach out to me and ask your questions directly at insurance@phassociation.org or give me a call at 301-565-3004, extension number 758. And then also, as I referenced earlier, the Medicare Rights Center, which you can find at medicarerights.org, as well as the Marketplace Health Exchange, which you can find at healthcare.gov. And then finally, one last reminder just to make sure we drill this into your head for open enrollment for the health insurance ACA marketplace. To get coverage starting January 1st, you have from November 1st until December 15th to enroll in a plan. Currently, for the 2026 plan year, you do have an extension at least until January 15 for coverage starting February 1st. For Medicare open enrollment, that goes from October 15th through December 7th. Again, people with Medicare Advantage plans do have the first 3 months of 2026 to make changes. And then finally, if you have a commercial plan, we recommend that you reach out to either that plan itself or your HR department if you have your plan through an employer to find out what your open enrollment dates are. Okay, thank you very much for sticking with us and for taking the time to be invested in your healthcare journey and learn how to be an advocate for yourself. Again, if you do have questions, email me insurance@phassociation.org. Thank you.